Good afternoon. Today we announce our plan to gradually reopen our businesses. It's the product of the collaboration between the Minister of Economy, Minister of Labor, the CNE-SST, and the public health authorities. Our challenge is to gradually restart the economy without restarting the pandemic. The reopening will be spread through several weeks. We only announced the first part of it today. We'll start with businesses that are not in shopping malls or that have a door that gives on the outside. We'll also start reopening our civil engineering construction, road construction, and factories. We will later announce a plan for other businesses. The idea is to gradually add workers and analyze the effect on the contagion. But one thing is clear, if we want our plan to work, we need to continue all our efforts of physical distanciation. And we need to continue to protect the most vulnerable. I'm counting on you all. Thank you.
Okay, good afternoon. You know that the federal and Canadian provinces are watching you with yesterday's announcement and today's announcements. So given that Quebec has so many COVID-19 cases and deaths, how can you justify reopening the economy with the virus that is still spreading?
Okay. First, we have to be very careful when we compare figures between provinces because we don't declare that the same way. Second, we have a very specific problem with the long-term care residences. So that's why what I showed, and maybe I can explain it in English. When you look at the debt every day since the beginning, upside you have the number of debt in residences, and downside in green you have the number of deaths in the population in general outside of residences. And we can see that the one in green for the last 2 weeks there was no increase. And it's relatively low. Even if you compare with Ontario, for example, it's very low. So we think that in the population in general, it's quite under control. So we'll gradually open schools and companies, but we want to make sure that the number of death and the situation in the population in general keeps being under control.
Second question.
Yes, my second question is for Mr. Fitzgibbon regarding your plan today. We saw an outbreak in a greenhouse in Ontario not a long time ago, and then we saw like a Cargill meat packing plant be in front of an outbreak. The pressure now is on businesses, is on construction sites, stores, that they have to put in place measures. What are your expectations regarding this, about how you want the working place to change?
Well, first of all, I think despite other jurisdictions, we have been very severe by closing manufacturing, for example, while other places, France and Ontario, have kept manufacturing open, but in fact, de facto didn't operate. The primary reason is the employees. I think it's very important that employees come to work and realize this is not the same place it was before the COVID-19. And frankly, over the last few weeks, between the CNE-SST, between public health, there's been a lot done to develop protocol. And I think the next few days, these protocol will be explained to employees. The employers know what they have to do. And I think that the proper information that will be provided to the employees will make it that people will feel safe to go and work. We're progressing, making a sequential Opening of manufacturing, 50 employees plus half of the excess. May 11th, May 25th. The retailers in the Montreal community is going to be later. So I think we're doing everything fine. Everything's appropriate, I believe, to secure people. Because if employees are not secured, they're not going to go to work. I'm not going to force them to do. But I think our approach is sound.
Thank you. Samuel Pouliot, CTV News.
Hi. Mr. Legault, many teachers point out that without full enrollment, they won't be able to teach new material to students because those who stay at home will fall behind. They say this is more about getting parents back to work than kids back to school. How do you respond to that?
Yeah, I think it's important for our children that they go back to school, especially the ones needing special services, the ones having learning difficulties. I think it would be a very bad idea because they got out 2 months ago or about a month and a half. So if you go to September, it means 6 months without going to school. I think it wouldn't be good for children having difficulties, and it represents 20 to 25% of our children. So it's very important, and that's mainly for them that we took this decision.
And about the CHSLD, do you have a timetable for when medical specialists will no longer be needed in CHSLD?
Okay, I think that we already have a lot less doctors in our CHSLD. I think that it's something like 150. So we have a lot less. Some may come on a partial time, but we already have less physicians in our CHSLD than a week ago.
Thank you. The next question is from Phil Autier, Montreal Gazette. It's for Mr. Arruda. Yesterday, you said Quebec will greatly increase testing for COVID-19. We are hearing from teachers and students who are scared of returning to school. Do you plan to test teachers and staff and children before they return to the classroom environment? That seems a wise idea.
Yes, in fact, it's clear we have actually capacity that is not used as it could be, and it's going to be changing this week. We're going to give even more access to tests to different kinds of population, and the ones that are going to open are going to be tested. On the case of an outbreak, but also to document the situation.
The next question, as a second question, is for Mr. Legault. Now that you are talking about reopening the economy, is it safe to say the worst of the coronavirus outbreak is nearly over for Quebec? How would you describe the state of the Montreal economy?
Of the economy?
Yeah, Montreal.
I'll add that to Pierre about the economy. But regarding the situation of the COVID-19, I think it's under control, except for the situation in CHSLD. But we have to be careful, so that's why we are reopening some schools and some companies very gradually. So we want to make sure that we don't have a second wave coming. Regarding the state of the economy, it's very tough, especially in Montreal. So maybe you can add a few words.
Yeah, basically, Montreal has been shut down to a large extent other than essential services. And that's one of the reasons we want to progressively reopen. Of course, we need to be sensitive to the public health situation, but there's a balance that I think we're trying to put together. And I'm very happy about the work that we did with public health. So I'm hopeful that the sooner we restart the economy, the sooner we'll be back to where we were back in December 2019, which is obviously a million-dollar question.
Thank you. The next question is from Raquel Fletcher, Global News. Can you explain your strategy for testing and contact tracing? Yesterday, Dr. Arruda mentioned that 15,000 tests per day are done. That doesn't seem like enough given hundreds of thousands of people will be going back to work and school at once.
It's clear that we never test, I would say, everybody. We always go by, I would say, échantillon, which means a specific quantity to try to extrapolate the data. But I can tell you that the capacity that we have now is going to be going very almost more than what is done in Canada actually soon. So I've got the confirmation with the ones who are responsible for that we're going to have a big capacity going up to high levels, I would say, soon because of new technologies coming soon and new contracts also with companies who are doing the tests.
Thank you. And as a very last question, when you see Ontario is keeping schools closed until at least June, and Justin Trudeau is also being very hesitant about announcing any reopening of the economy just yet, do you not think Quebec is opening too soon?
Well, again, I'll repeat what I said. If you exclude cases coming from the CHSLD, long-term care residences, our situation in Quebec is under control, and there's a very low number of cases and death. So, and also our number of people in hospitals is also under control. So, I don't know exactly what's the situation in Ontario, but our situation is under control, except for long-term care.
Thank you. So that's it for today. C'est ce qui complète pour cette conférence de presse.